Many times you'll see the phrase telehealth and telemedicine used interchangeably, where they seem like they mean the same thing. And for many uses, they actually are the same thing. But what are the differences between telehealth and telemedicine? Well, the idea of telemedicine or telehealth is a method of delivering healthcare services by some electronic means, whether it's a video conference, whether it's connection to devices. Usually what most people think is it's a video conference with a doctor or a medical provider. And that could be true. And that is typically what the definition of telemedicine is. However, telehealth could also include things like connecting a glucose monitoring device to a medical facility. It might be other types of monitoring. It might even be conferencing between two medical professionals discussing the case of a patient. It could also be remote admissions. In some cases, if you walk into a medical facility, you're admitted using a screen rather than a receptionist. That's a version of telehealth. Sometimes telemedicine is more common in rural areas where there's not a large number of brick and mortar footprint hospital doctor facilities, and telehealth or telemedicine is provided to give those rural residents access to healthcare. There are even examples of robotic surgery where physicians in one location where the patient's located are assisted with robotic connection to a provider at another location. That's a pretty extreme example. But what most people consider when they think of telehealth is where they are able to access a doctor, discuss their medical needs, get a diagnosis, maybe get some even preventative care by not having to physically go to the facility in person. And many times that's helpful because, look, when you have a medical condition, sometimes your mobility is affected. It's not as easy to get in a car and drive somewhere. Sometimes it's not as convenient to go to an appointment. The travel time to and from a medical facility can add several hours to a medical appointment. If you don't have that kind of time in your day, being able to do it through a video conference or remote access can cut that time down dramatically and allow more patients more access to their schedule. There are some consumers who have a medical condition that they would like to get treatment for. However, they don't have the time in the day to drive to a doctor, so they just ignore it. And they just don't make an appointment because they know they can't take time off from work or they can't get somebody to drive them. Where telehealth or telemedicine can allow them to access a qualified physician remotely from the comfort of their own home using a video camera internet connection. Now, it doesn't necessarily, it's not relevant in all conditions. Sometimes a doctor needs to see something or test something, but in many cases it can at least be the start of a diagnosis or treatment. And then on the provider side, telehealth sometimes can mean things like training of medical providers, things like administrative meetings, continuing education, that kind of thing, where telemedicine might be remote monitoring of the patient or uploading patient data. So those are the different general definitions of telehealth and telemedicine. In many cases, there's overlap between the two. Either way, look at what remote options might be available to you as a consumer through your medical provider, your insurance company, because there may be things that make the receiving medical attention easier than what it was in the past. You may not be aware of all the offerings from your medical provider or your insurance company and seeing what's available. You may still have to go physically in person to the doctor or to the hospital. However, you may be able to start that process so there's less time going there and they're already ahead of the game. Once you show up in person, they already have a lot of information collected from you and maybe even are able to go farther with that in-person diagnosis than they could otherwise.